This is mainly like a waiting area and also welcoming area for us. Once the patients come inside from the main floor, like we just pick them up from there, offer a tea or coffee until we make the first registration and the first introduction of the hospital. And then after we start all the procedures, like one of my colleagues will be in touch with them all the time, and we'll be with them all the time inside the hospital. They will be just, doing all the assistance, even the translation with the doctors, the reports providing them, scheduling the appointments, everything is under control here with me and under my colleagues.
Normally all the doctor rooms are like this. I mean, there is front desk and front part and back part.
Right.
Why back part? Because let's say another patient wants to come in and he will not see a patient who is naked. It's very helpful for examination.
It's give us a privacy.
Yeah.
Give the privacy to the patients.
Mm-hmm.
So this is one standard examination, or as I said, in the front side, the doctors first place like the patients like just in touch with them and listening their complaints, taking a look at the old records of every Acibadem that the patient visits. We are using a really good system called Cerebral. It's only special for the Acibadem. We are the only one who's using that. Let's say the patient visit another Acibadem all around the world. Doesn't matter, in another city all around the world. We have the records in the system. So let's say that the patient had an MRI in another Acibadem, wishes to come to see this doctor. So doctor just needs to go to the patient's protocol number, its individual number, and we'll be able to see all the records and the imagings there. Okay.
He has access to the central system. Just ENT and ophthalmology rooms, they don't have this kind of thing because they have another machinery. They're looking at your eyes and your nose, ear and throat. That's why they don't need this kind of place in ENT and ophthalmology place.
As you can see, there is one physical examination area, and in this room we are able to do the PRP injections, the preparation of them. Mm-hmm. So every room they have this, and as I said, this is a standard one. So it's like every room that you go, every doctor's office that you will see, it's going to be the same like this. For the patient who is having the surgery, let's say, or the preparation for the surgery, not using the front elevators, only using these ones. And after the 6th floor is the inpatients rooms, and after the operations, when they are needed to move out from the operating theaters, they are using these special elevators. And this is a little bit private than the front corridor, as you can see. That's why we are compact.
Is this a common design?
It's a common design every boutique hospital of Acibadem. So like it's a little bit different than in mega complexes like Maslak in Altunizade. It's a little bit different because it's not really a tall buildings. Like they are not.
They are flat.
Yeah, they are flat and little short numbers of the floors, like 4th or 5th floor, let's say. But we have here 16 floors. So we needed to design it like this one, to make it a little bit more compact and easy to access every floors. Okay?
Yeah.
So let's move on. I will call my colleagues to see if there's any available inpatient room. In every room, they have this button, special button, to call the nurses. If they need anything, they just need to press the button, and you will see these ones are making a little bit light and the little bit sound, so the nurses are able to reach them in real fast. Okay, so we have these waiting areas, guest waiting lounge in here in every floor. Is for the companions of the patients, and here we can get inside if you like to shoot, but not to shoot inside.
Is it a Turkish architecture or who designed?
I'm not quite sure, to be honest.
It's Turkish architecture, yes. He's pretty famous for designing Acibadem hospitals, mainly most of the hospitals. And other hospitals are also hiring this designer, and they always say that this designer is Acibadem hospital designer.
Mm-hmm. Now, like Acibadem, in every project that we have a special team.
So he's younger than. He's a younger architect, right?
No, he's not younger. I mean, as I know, he's like 50 ages, at the ages of 40 or 50.
Acibadem has their own team now, Acibadem Project Management. So they are designing like for the future, like all the hospitals and all the centers. Now they are designing and building. We do not use like we did not work with the individual architecture, so to be honest, last 6-7 years, I guess. We have the floor, and the front desk we have our codex. Like the office
So the floors
files.
are the same.
Yeah. This is one of our biggest rooms, just in case we knock the door. Okay. Okay, so this is one standard, as I said, one of the biggest in every floor, the 13th, room 13th. Let's say it's unlucky, but for us it's the biggest.
It's not lucky.
Yeah, it's my lucky number also, 13. I choose it as the luckiest number. So one private bed, this couch can turn into a bed, so one companion can stay. If the patient needs more, we will put another couch in here, so more than one person can stay. And back of you there are like private toilets and showers in here. As you can see, it's really,
It has
really.
emergency button also.
Yeah, definitely.
As you can see, you can call nurse if you need help.
Day shift we have 6 nurses and 1 responsible, and the night shift we have 3 nurses and 1 supervisor in every floor.
And everyone's on alert.
Yeah. And what we do in here, especially in Fulya, we have this call line 7878. It's international and the Turkish one. So it doesn't matter what the patient needs. To order something from the cafeteria, speak with one of us, just to chit chat or say something to the doctor. They just dial the number, and if they speak Russian, like once Russian speaking agents will be on the phone. Like Turkish, English, we have like Arabic, doesn't matter. We have the service 24 hours. Yeah, 7 days, 24 hours, and you can see it's standard area. Acibadem wardrobe. There is a safe inside, a backup bed sheets, like the pillows and the pillowcases, and there is a small fridge there.
Window.
Yeah.
You can use it.
Yeah.
But it's empty, you can put there your food.
Definitely. While we are going to the Acibadem Sports Center, you will see we have a shopping mall down there. So, like in short term, like long term stays, the patient just go there, do the shopping, come back here, put everything inside the fridge, and they can. In health sector, everything is 24 hours.
Yeah.
Like everything open in the hospital, like in the cafeteria, the nurses for us, like everyone is available for 24 hours. And from there, we will go to the Acibadem Sports Center. Because of our location, this part of the Istanbul is really located in to Beşiktaş, Mecidiyeköy, Nişantaşı, which is like really have more population of the doctors' offices, like the private offices. So they just need a place that they can trust for their patients to perform the surgeries and make them inpatient in here. Here is the first MRI room in here, which is like 1.5. This one. And mostly used is this one. Şu arka çok sadece göstereceğim. Also, this is like the changing areas where we taking off all the metals and changing the clothes of the patients in here. And this is the MRI device in here. Just please be careful after this part. It will take your phone away from it. It takes like 25-30 minutes maximum, one MRI without contrast, and with contrast it takes like 45-50 minutes. We give the music, something to watch for the patient. Çok teşekkür ederiz. Something to watch for the patients for 45 minutes. It's a little boring, but we have the person's images and the results from the 3.0 Tesla MRI.
Great things take time.
Yeah, definitely. And takes effort,
Right.
Inside the cartridge, I say. Thanks to this machine, they are able to see exactly what they like by millimetrical. They know exactly where they need to apply the needle. So this one, it's like from there, from the springs, from there here, they are seeing where to apply that, and they're able to do that afterwards. Cephaloscopy. In the next room, there is an X-ray room. Here on by sitting, by laying down, they can just adjust this one, and they're just moving around this, taking the X-rays of the body parts they are needed to see. For the bone densitometry here.
Doctor has given us sports rehabilitation, especially for the patients who have passed the surgery those sportsmen, and doctor helped us to give them sports rehabilitation. It's like it's the only sports rehabilitation in Turkey, I guess, because there are some state places, but like this is the only place. Acibadem Sports.
Did you see the Acibadem Sports?
We are going now.
We are going now, it's okay.
So this is like as I said, the message area. It's open for everyone. You don't have to be a partner, like a patient of the Acibadem. You don't have to be a partner. You just call us or call here and make a reservation for yourself, and you can enjoy it for 1 hour. It's like we have 2 different rooms for the like 2 different private rooms and 1 couple room just back there. And as I said, it's like for 45-50 minutes. It's amazing.
Yeah, I'm sure you feel different after.
Yeah, definitely. It's open for marketing also. It's open for business, but even for yourself. If you have time, just let us know so we can arrange something.
How are they trained?
Sorry?
How are they trained?
Trained?
Yeah.
Well, like it's a professional sports massage again.
Right.
Like if you have one specific problem that you want to fix, they will focus on that one. But basically, the therapists are coming from the body, so they are professional massage therapists.
Indonesia.
Yeah, Bali.
Yeah.
Like used to be from Thailand, but now like we have three therapists from Bali and 1 from, if I'm not mistaken, from Cameroon. So it's like it's depending on what you want to do. With all therapists, like the one coming from Cameroon is specialized with the sports massage. So you have, let's say, you needed a lymph massage, lymphoma, for example. You just book with her, and you can get like sessions. Let's say you want to do it like 10, like as a package, you will get like 10. So like they give you a schedule and a routine to follow inside as a like training. And after every training, you come here and you do the massage.
I think that's really cool to see that a part of the a part of the hospital.
Yeah, definitely.
It's
Yeah, like everything. It's
very
as I said, in every
Sure.
Acibadem, everything is. This is the couple room, as I said. I don't know if you fancy about it.
Yeah.
Maybe next time. All right. Sports medicine, because professional sportsmen especially use this, because layer nails and like the soles, insoles, and can be a really big problem, especially for the football players, professional soccer. I don't know if you say soccer, because
Football, yeah.
like the shoes are a little bit tight than usual, like the normal sports wear, normal sneakers. Especially it's really important for us because it's medical hand and foot care. It's not really manicure and pedicure only. Like the ladies working here, they're also specialized in this area, so it's connected again with the sports medicine. Like inside, you will see we do perform guide test. For example, the patient has imbalanced insoles, like the soles, like in the feet, flat feet, for example. After the first examination in the hospital, we direct them to here. We do the guide testing, like the walking test, on a pad, and we know the pressure points of the feet. Okay. So they need a special insoles, for example. They come here after the guide test. They do the casting. Here. We know the size of the foot, and then we produce the insole. Here, exactly. This is the casting area. But what we are manufacturing here are these.
Customized soles.
Yeah, I know this.
So these ones, doesn't matter what you want, how many pairs, how many, like what color, what size, what shape, what texture, we can manufacture here. And after the guide test, the pedologist here, the casting, physical examination, and within 1 week you have, if you like to have 20 pairs, you have 20 pairs of this. For your classic shoes, sports shoes, sandals like this, slippers, anything, you can get it within 1 week. Yeah.
Very cool.
Yeah, this is like one examination.
Do you guys do you offer this service remotely, like from other cities, other places?
Definitely, but they need to be here at least one time as physical, because all the testings and the castings should be done in here by the pedalog the, you know, this
necessary testing.
yeah, definitely. They needed to have this analysis first. You will see it's really precise test, you know, like it's like millimetrical again. So like the things that needed to be manufactured and like produced needed to be really, you know, precise also.
Right.
That's why. At least one time, and after that we can just send it to their you know, like residency area, residency city or the country even. Those are our partners, and we are sponsor of these professional sports clubs and the federations. As you can see, there is the Turkish, you know, Turkish wrestling team, gymnast team, and the volleyball team. Those are some special clubs, football clubs, professional football clubs, volleyball clubs. That yeah. Like this is from a Romania gymnast team. You know, they are from Serbia, for example.
There is also Bulgaria.
Yeah.
CSKA is Russian.
So what we do
CSKA.
and what we offer them is basically the performance analyses that we will do inside, that I will show you and introduce you, and for their sportsmen, for their players, let's say, we perform the treatments in the hospital, let's say for a surgery or for the physical therapies, that we are the sponsor of stuff. Okay? We'll move on. You will see some jerseys coming from this professional sports clubs and their sportsmen. The color is really nice. I don't know if you like Euroleague basketball, but Anna Dekolo was here playing for Fenerbahce basketball team for like 2 years in Rome. It's really famous. I don't know if you like Euroleague. A FIFA Medical Center of Excellence, as I said. If you like to take a picture all together, we can do it in here because it's a good view and it's bigger than the one in the hospital. Gym area again, but working with the personal trainers. Okay, so it's open for everyone. Like you can just need to be a member, and that's it. You can just come anywhere, anytime. And in the back there is the performance analysis area that we will go again accredited from FIFA. And on the left you will see the physical therapy area, which is working connectedly with the hospital again. Okay, so we can continue from.
So is the physical therapy? Is it?
Done by
But I mean, it's always open.
Not always. They have working hours from 8 to 6.
Okay.
8 in the morning till the 6 p.m.
And the working hours is it scheduled time, or they're here when you need them, or if you need them? Doesn't matter.
Not exactly. It's like working here, like from 8 to 6.
Okay.
And it's like always organized from the doctors. Like they know like at what time they need to be.
By appointment.
Right.
Only by appointment, and doctors are prescribing you physical therapy.
Basically, it's now one sportsman is using there, as you can see, but unfortunately we cannot get inside because it's full now. But as you can see, it's accredited again from the FIFA. İçeri sporcular var şimdi.
Matches are very important because they show performance of sportsmen. There is different kind of devices. I mean, for example, some of them are calculating how much oxygen a sportsman has in muscles, for example, or how much potential the sportsman have. It's very important for a sports world. Very important.
And this is the guide test that I mentioned, like in the first room, to produce or manufacture the salts. Yeah, like just few steps on this one, and on the system, on the computer, we have a full report. Just the patient needs to walk on this one for 3-4 rounds, and we know the pressure points afterwards. But inside from the machine that you will see, they are all connected to the computer again. So after everything, like after spending half a day in here as a professional sportsman, we know like what should
Trends.
be, what should be more,
Sportsman.
put more effort or put more exercise on. Like we know like the treatment, how it goes. Like also, for example, the patient had the sportsman had the surgery on the meniscus, for example. We know like the performance of it after the surgery in here on this test, for example.
Here by standard, right? So if there is an injury, you know what happens
Exactly.
after
As a standard,
and what they were like before.
With their, like the doctors of the club,
Right.
and one doctor from us. He's the one. He's the head of the physical therapy doctor in here. He's the head one, Dr. Mesut. And also like we have one analyst in here. So like 3 observers and the sportsman doing all the analysis. They are using the power of the water to heal the muscle tears, or I don't know, like any edema or anything. Yeah. And here's the cryotherapy. Probably it's used really recently. Yeah, it's under some repair, I guess. But basically, this goes minus 130 degrees in one room. It's like really cold. We say cold box. You know, like the patient, this professional sportsmen, they use it. They stay only 1 minute inside, minus 130 degrees, and after that they enter the sauna. So it's like after everything, after hard training, you know, like a really rough game, they are able to relax the muscles again and repair some small tears of the muscle, small injuries, let's say. So this one is only one and only in Turkey. Amount of something,
Really cool.
You know, like let's say Kilimanjaro. You want to exercise in Kilimanjaro. You adjust the level of oxygen, altitude, and the heat. It's a really cool design. It's one and only in Turkey again, and it's only for the sportsman because it's a little bit dangerous. You know.
Yeah.
It's like open for everyone, of course, but you just need to register yourself. And again, like you just need to put yourself in a schedule. They tell you at what time and on which day we have the group lessons, and you can come here and do the exercises all together with the group, but the observation of one personal trainer.